There's so many different principles and events in the world that somehow have an economics root to it. And one of the best ways to win a debate is if you know what's happening in the world.
It's one of those things that everyone thinks is quite straightforward. It's either finance or banking, but it's really not.
A career as economist gives you overall high flexibility and the ability to adapt to really different working contexts.
The main tasks of an economist is to find policies that help maximize social welfare, which is really to say health in its broadest terms.
So we know that health is an area where you have kind of unlimited demand. You're always going to have people that need healthcare, and they're going to need different types of healthcare, but you have very limited supply, whether that's money, the money that you put into your healthcare budget, whether that's the number of doctors and nurses you have, even the number of hospitals and hospital beds. So economics, in terms of the principle of marrying supply and demand, when it comes to healthcare, is very difficult because of this imbalance between the demand and supply. We also know that it's really important to be able to project how your healthcare population might change over time. So if we can already carry out analysis that tells us X many people will be living with chronic conditions like diabetes or cardiovascular disease, then we can change the way that we train our staff or kind of how we can prevent these problems from exacerbating in the future.
My job is to make sure that we are asking the right questions in our analysis, that our econometric approach and methods are the right ones, and that our results are communicated well, both to the public, so to you guys, and to policymakers.
The amount of funding that we spend on healthcare has been growing over time, and we ask questions like, how will the population change in 10 years' time? How healthy will we be? How much health and social care will we need? And how much funding will be needed to deliver that?
Analysis now, our economic research in select committees and various influence in politics and government really brings confidence to what you're doing, because you can see how it applies to UK policy.
What's unique about economics is it provides you with the tools to help design policies, interventions that can generate positive change. I found it, studying it, both immensely satisfying and interesting.
Studying economics would allow you to read and interpret correctly what happens around you and the implications of policy decisions on the society.
And when I was looking at economics to begin with, I had the same idea. I thought it was just finance or banking, but actually what I do in my workplace is look at health economics, which I didn't even realize was a thing before I started, but economics is applied across everywhere: trades, the environment, business or health.
If you've chosen it and you've studied it and you found yourself in a job that actually maybe isn't really your interest, it's really easy to pivot away and use your knowledge of economic theory to find a new opportunity. So it just offers you a lot of versatility that perhaps other careers don't.